I'd like to acknowledge the Indigenous custodians, the Wurundjeri people, and acknowledge their ancestors past and present. As the only female plenary speaker, I would also wish to you to have a happy International Women's Day. I think a lady cracked it for the panel this afternoon as well, so it's all up from here for this conference for women. It's a real change of gear from alcohol, but I hope you can find a place in your heart to think about cannabis, even if only briefly. What I want to cover is just a little on my perspective. Cannabis is an extremely controversial drug, so I'll be bold and suggest that there's probably a few things that there is some consensus about. Not surprisingly, I'll be talking about young people in cannabis, a little bit on the epidemiology, how big is the issue, then of course its specific relation to crime amongst young people. I'll talk then on some prevention, some supply reduction, and more, where I feel more comfortable speaking about interventions in general. Commander Scipione talked about alcohol as just a special kind of food, is how it's now come to be thought. And I think cannabis is still considered by many as just a special kind of drug. We hear it described as a soft drug. So there's much to be learned and communicated about this very complex psychoactive chemical group. Just for those of you who, and I hope there's not many, who haven't heard of the National Cannabis Centre, our aim is to reduce the use of cannabis in Australia by preventing uptake, but also, most importantly, in some ways, providing the community with evidence-based information and interventions. We're a consortium. That's a challenge, but I think we've been pretty successful wrangling 8 research, clinical and policy development agencies who come from a variety of perspectives, from the addictions, from mental health and also from the criminal justice sector. And the AIC are one of our partner organisations. They produce for us a wonderful series of bulletins and research into practice briefs, and I suspect that's why I'm here today, because they are partners. So let me be so bold as to suggest what there is some consensus about with regard to cannabis. Much like alcohol, it is extremely widely used, and it's the most highly prevalent drug by far, illicit drug in almost all Western cultures. We're very early in the stages of learning very much about cannabis and about the endogenous cannabinoid receptor system. These were only beginning to be identified 4 or 5 decades ago. But at the moment, we believe there are at least 2 endogenous cannabinoid receptor systems, so our body is actually designed for the use of cannabis in some ways, which is a bit perplexing for us. And the functions of those are largely unknown. They affect every system in the body, particularly the immune system, for example, and we know really nothing about how to best tap into that potential. The other really annoying thing about cannabis, unlike alcohol or nicotine, it's not a single drug, it's a group of drugs. And there are about 80 individual cannabinoids that make up any kind of cannabis plant. And to be even more irritating is that they don't even have the same effects within the plant. We all know delta-9 tetrahydrocannabinol, or THC as we like to call it. It's the main psychoactive drug, the main driver for people to use cannabis, if you like, but there are much more important cannabinoids, including cannabidiol, CBD, which has drug opposite effects. So we know that THC can provoke feelings of paranoia, even of psychosis, of anxiety. CBD has the opposite effects. It reduces anxiety and it reduces feelings of psychosis. So it's the mix of these drugs in any particular plant which is so important. And we're just now, thanks to Nick Bingham, who's the commander of the drug squad in New South Wales, about to start testing cannabis in Australia to see if it's undergone the same kind of changes that have been experienced in the UK, for example, where the good cannabis, the CBD, has been practically bred out of the plant. And people have suggested that that may be contributing to why we're seeing more of the mental health harms currently. Cannabis, of course, also has contaminants. We will also be looking at that, but there's much to be learnt there. It really depends on the growing technique and if there's any nefarious activities at the dealing level, which, to be honest, we don't see in Australia, but we have seen in Europe. Cannabis users also are a bit scatty, and they use lots of other drugs. And if only they didn't use tobacco and alcohol and occasionally amphetamine-type stimulants and cocaine, we could pin them down to say what some of the harms might be associated with their cannabis use. But this is always a complicating factor, and why my laboratory friends are driven back to working with rats and mice, because you can control these things. Although, interestingly, you have to specially train rats and mice and breed them, and mostly girl rats and mice prefer cannabis. It's a very interesting drug, and they have to be young. Adult rats don't like cannabis, only young rats. So it's quite a challenge, and I think we'll hopefully learn quite a bit about cannabis from our rodent friends. The concern is that cannabis use, and to be fair, also alcohol and methamphetamine are involved with this, is associated with psychotic disorders at their onset and markedly worsen the prognosis if people continue to smoke. This window of adolescence that we're learning more about brain development and plasticity and pruning and all those good things, it's the period where it's also the temporal proximity to the onset of cannabis use and of psychosis. So there's always arguments about, well, they would have developed it anyway, and there's a great deal of research being done, and I think probably in 5 years' time I'll be able to point to you actually a part of a causal mechanism which will be genetic, I am betting, that triggers cannabis use triggers psychosis when cannabis is used in adolescence. It's also associated with other negative outcomes, which I'll just mention a little bit about later. So, what is the extent of the problem? I thought I'd use today the latest data, the Australian Secondary School Student Surveys, and we have some trend data here. It was collected in 2008, 24,000 12 to 17-year-olds, but it was only published last year, so it is quite recent, although it was collected a while ago. And I think what stands out there is the fantastic reductions in cannabis use in all of the age groups, but particularly pleasing to see in those very young age groups is where we're seeing the most marked reduction in cannabis use. This is also seen in the household surveys that the National Drug Strategy run. So we're having fantastic success with deterring young people who are, frankly, the most easily deterred. I'll talk about the others in a moment. And we can't pin down exactly, is it public health initiatives, is it school prevention, but working together, we're particularly successful. We're seeing similar kinds of patterns in other countries, but not nearly as marked as we're seeing here in Australia. For those of you, because there's so much emphasis on alcohol, I'll mention there is also a reduction in alcohol. Alcohol use peaked in 2002 at around 30% and is now down to 18%. So it's not all gloom and doom for alcohol either. This is looking at age and gender in a bit more detail. I started my research life looking at women's treatment services, and I've always had a particular interest in gender. And unfortunately here we're seeing that the girls are catching up with the boys, as we see with alcohol and other risk-taking behaviour. This is no longer a gender-protected activity that the girls are engaging equally as much as the boys. And I'd have to say, as the mother of a 14-year-old, this is getting pretty personal for me, pretty scary. So I'm certainly watching out myself in my everyday life. Here is recent use, using cannabis in the past year. We can see about 1 in 9 overall are using cannabis, and a third of males and a quarter of females are using it 10 or more times. So that's certainly likely to be putting them into the higher risk categories. Now, I alluded that we're having good success with those that are easier, the experimenters, to dissuade from ever getting involved in an activity, particularly as it's smoked. It's portrayed as a bit of a dirty loser kind of drug in some circles now. But this is at the household survey data, looking at trends at those that are at the tough end of the spectrum, if you like, those that are most likely to be involved in the criminal justice sector. And here we see that, in some ways, fortunately, that the 14 to 19-year-olds are at the lowest rate of daily use, but unlike the older groups who have peaked and are coming down, we're seeing the trend in the other direction for the younger age groups. Similarly, looking at that really tough group, the daily users, we've got here two measures. One is difficulty controlling use, which is the closest proxy we have to dependence in the household survey. And once again, the 14 to 19 age group are going up, and the others tend to be levelling or on the opposite trajectory. Similarly, with very heavy frequent use, using more than 10 times a day, the 14 to 19 are the highest group and going up. It's that same mentality as with alcohol, kind of smoke till you green and fall over. So we need very much more work to do with this particular group. Another special group that we're very concerned about are Indigenous communities. The rates of recent cannabis use amongst Indigenous Australians is double that of the general population. The data is quite poor, but when you put it all together, that's the general story in urban communities and across the country. But we have very particular concerns about cannabis use and associated problems amongst remote Indigenous communities. This is the work of Alan Clough's group, and in the top end of the Northern Territory, cannabis use was not detected at all 30 years ago when they were talking with communities and moving through there. But they were targeted by criminal gangs, essentially, and we saw from there a rapid rise over the 90s due to this expansion of local trafficking. When Alan did his survey in 2001, he estimated, and he was living in the community, he wasn't kind of a blow-through, he knew this community very well. And it was estimated between 60 and 73% of males, and much lower, but nonetheless concerning proportion of females in the Eastern Arnhem Land communities were using cannabis and at very high levels, causing very severe disruption in those communities, such that, for example, 1/6 of the whole community's cash reserves were being spent on cannabis. The AIC, Judy Parton and her colleagues, talked to the police in these communities at the same time, and they echoed the same sentiments as were being found in the communities. The police also thought cannabis was very commonly used in those communities and that it was a problematic use.